Welcome to Section 3 of Cardiac Pathology. In this section, we'll be discussing arteriosclerosis. Let's get started. Arteriosclerosis can be simply defined as hardened and thickened arteries. There are three types, including atherosclerosis, arteriosclerosis, and Monckeberg medial sclerosis. Let's discuss atherosclerosis first. Atherosclerosis is a fibrous plaque that obstructs blood flow into large and medium-sized arteries. The exact mechanism of how this occurs is very important to understand and high yield for step 1. Here's an image outlining the pathophysiology of atherosclerosis. Off to the side, notice that we have shown the endothelium, tunica intima, and tunica media. So the first step in this process is endothelial injury, which we can see right here. The endothelium is a protective barrier, so once it's injured, lipoproteins, such as LDL that are circulating in the vasculature, can leak into the tunica intima. So step 2 is LDL enters through the injured site. Next, the LDL becomes oxidized and macrophages enter the area where they consume these oxidized lipids. This results in the formation of foam cells, which are simply macrophages which have engulfed oxidized lipids. So for step 3, macrophages enter the site and form foam cells. Step 4 involves platelet and inflammatory cells infiltrating the region. These, along with cytokines and later smooth muscle cells, secrete cytokines and growth factors. For example, platelets release platelet-derived growth factor, which induces smooth muscle cell hyperplasia. So for step 5, we can see that smooth muscle cells are undergoing hyperplasia and are leaving the tunica media to the injured region. Smooth muscle cells, along with macrophages, release cytokines, which results in extracellular matrix deposition, including collagen, elastin, and proteoglycans, which we can see right here. This ultimately results in the formation of a fibrous plaque or cap. This entire structure is called an atheroma. Finally, you should know that the vascular areas that promote turbulent blood flow are most commonly affected. This leads to endothelial damage and predisposes these regions to atherosclerosis. Of all of the vascular territories, the coronary arteries are the most commonly affected, which is why so many people die of coronary artery disease. A less common area of turbulent blood flow is the lower abdominal aorta. Risk factors for developing atherosclerosis include dyslipidemia, diabetes mellitus, obesity, hypertension, and smoking. These are very prevalent in the United States, so it's no wonder that so many patients have atherosclerosis. Atherosclerosis leads to many complications, but can be simplified into 4 major categories, including stenosis, aneurysm, thrombosis, and embolization. As we just learned, atherosclerosis results in a fibrous plaque that obstructs blood flow. So over time, this plaque can enlarge, and once it obstructs greater than 70% of the vessel, this leads to symptomatic ischemia. So for example, ischemia of the coronary vessels can lead to angina or chest pain. Ischemia of the bowel can lead to chronic mesenteric ischemia. Ischemia of the peripheral vasculature can lead to claudication. If you understand the pathophysiology, this makes a lot of sense. Obstruction leads to ischemia. Aneurysm can also form as a complication. This is because the thickened tunica intima leads to ischemia of the vascular wall, which then results in wall weakness. If the wall becomes excessively weak, an aneurysm can form, such as an abdominal aortic aneurysm. The last 2 complications are thrombosis and embolization. Let's take another look at the image to understand these better. Recall that the last step in atherosclerosis is formation of a fibrous cap. If this cap ruptures, the vasculature is exposed to the necrosis that would otherwise be covered up. So inside this region, we have all of this oxidized fat, and this is termed a necrotic lipid core. So exposure to the necrotic lipid core activates the coagulation cascade. As platelets migrate to the area, they quickly aggregate and form a large clot, or thrombosis. This occludes the vessel and results in infarction. So just imagine that we have the other side of the vascular wall over here, and rupture of the fibrous cap would expose the necrotic lipid core, platelets build up, and the vessel becomes occluded. Occlusion of the vessel results in infarction. So for example, thrombosis of the coronary vessels can lead to a myocardial infarction, while thrombosis of the cerebral vasculature can lead to a stroke. On the other hand, the fibrous plaque can dislodge and travel to a distant location, like this. Again, this can activate the coagulation cascade, resulting in an embolus. This often occurs in the pulmonary vasculature from clots that dislodge from the lower extremities, resulting in a pulmonary embolism. Here we can see an image of an embolus in a medium-sized artery of the kidney. The key finding here is the presence of cholesterol crystals, which we can see right here. All right, so far we've discussed atherosclerosis. Now let's move on to discuss arteriosclerosis. Arteriosclerosis is occlusion of the small arteries, so the arterioles. There are 2 types, hyperplastic and hyaline. Let's discuss hyperplastic first. Unlike atherosclerosis, arteriosclerosis is due to smooth muscle cell hyperplasia, and this results in occlusion of the lumen. This is caused by severe hypertension. As the blood pressure rises, the smooth muscle cells divide in the tunica media in an attempt to control the blood pressure. Classically, this results in an onion skin appearance on histology. Here's an image of hyperplastic arteriosclerosis in the kidney. We can see an arteriole right here. Notice that this region is expanded, resulting in this concentric layering of smooth muscles, giving it that onion skin appearance. All right, the other type of arteriosclerosis is hyaline arteriosclerosis. This is due to protein deposition in the vascular wall, which again results in occlusion of the lumen. This is caused by uncontrolled hypertension and diabetes. With hypertension, the elevated blood pressure pushes protein into the vascular wall, and with diabetes, the glucose combines with protein through a process known as non-enzymatic glycosylation. This causes weakening of the blood vessel wall and allows protein to enter the wall. Eosinophilic hyaline thickening can be seen on histology when stained with a periodic acid shift stain. I'll show you a picture of this in a second. Lastly, complications include ischemia, atrophy, and scarring. A common disease associated with this is known as arteriolonephrosclerosis, which is scarring of the nephrons due to hyaline arteriosclerosis. Here's an image of hyaline arteriosclerosis in the kidney. Notice the pink eosinophilic thickening right here occurring in a renal arteriole. All right, the last type of arteriosclerosis is Mönckeberg medial sclerosis. This is characterized by non-obstructive calcification of the tunica media within medium-sized arteries. It's clinically insignificant in the sense that it doesn't cause symptoms. However, it may be seen on mammography or X-ray as an incidental finding. It classically has a pipe stem appearance on X-ray. Here's an X-ray of the lower extremities. We can see extensive calcification of the femoral arteries right here, and notice that it has the classic pipe stem appearance. All right, now that we've covered the information, let's review with a question. A 59-year-old male presents to the emergency department due to sudden onset chest pain that began 30 minutes ago. He is diaphoretic and short of breath. Despite aggressive intervention, the patient dies suddenly. An autopsy reveals the presence of atherosclerosis throughout the coronary arteries. The pathological process most likely began many years prior to this patient's death, beginning with injury to the vascular endothelium. What pathological process occurred directly following injury to the vascular endothelium? A. Foam cell formation. B. Extracellular matrix deposition. C. Entry of LDL through the injured site. Or D. Smooth muscle cell hyperplasia. All right, the main takeaway from the question is that the patient had a myocardial infarction, and atherosclerosis was present at an autopsy. We're told that this process began with injury to the vascular endothelium and asked what occurred directly following this. So with this in mind, the correct answer is C, entry of LDL through the injured site. From this image, recall that injury is the first step, followed by LDL entering through the injured site. A, B, and D are all incorrect because these steps happen later and did not directly follow injury to the vascular endothelium. So again, the correct answer is C, entry of LDL through the injured site. And that concludes this section.